The midlife crisis has kept sitcom writers busy for decades, but the reality is a lot less funny. The midlife crisis is a symptom of what's been called male menopause or andropause. And for those men who experience its symptoms, breast enlargement, reduced strength and muscle mass, infertility, as well as a reduced interest in sex and even erectile dysfunction, it's no joking matter. And their mental health is also affected. They're experiencing anxiety, depression, and cognitive impairment. Well, at Nutramedica, our mission is to give you the tools and the information that you need to care for your patients, even for those who show up in an exotic sports car. So we asked Dr. Jonathan Prousky to share his insight into diagnosing and treating andropause. Dr. Prousky is a psychotherapist, an author and an educator, a chief naturopathic medical officer, and a professor at the Canadian College of Naturopathic Medicine. Welcome, Dr. Prousky. Welcome to the show.
Hi, I'm so happy to be here. Thank you for having me.
Dr. Prousky, we know that both men and women go through natural hormonal changes over their lifetime. What is the difference between menopause in women and what we're now calling andropause?
That's a great question. So menopause in women is both, I would say, medically and culturally understood as a cessation or stoppage of hormonal production that's characterized by a real drop in estrogens, predominantly estradiol, and also in progesterone, let's say between the ages of, say, 48 and 50, whereas andropause in men, which is much different, is, I would say, less culturally understood and in a sense less medically understood. Though you'd be surprised, there is a paper in 1944 by Heller et al. That describes symptoms of male climacteric that showed a reversal of testosterone deficiency by giving testosterone and not placebo. So that's sort of interesting. And essentially, andropause encapsulates a disorder that's characterized by a decline in testosterone.
Right. And what are the symptoms that you would see in your patients who you suspect may be a victim of andropause?
Well, yeah, let's sort of go back a little bit. So testosterone, as everybody knows, it's a hormone that's responsible for the secondary sexual characteristics like facial hair and pubic hair that appear at puberty.
Mm-hmm.
And testosterone is important since it has a role in all sorts of facets of what it is to be a person and to be male in a sense. And it involves itself in our sex drive, our libido, bone mass, fat distribution, muscle mass, and strength, and even the production of red blood cells and sperm. So when I'm thinking about the presence of andropause in practice and the symptoms, it's basically people that are struggling with issues of sex drive, of sexual functioning, of feeling good and having a general sense of well-being. They may be having mood issues and even potentially some cognitive-based issues as well. But it's like you're losing your mojo. It's in a sense you're not yourself anymore. And that's, I think, what's so hard for people to understand. They think that, what is happening to me? Like, what might be going on? And they're not necessarily believing or understanding that it could be due to their testosterone decline that happens.
Yeah, I mean, it comes to mind that at one point it could be testosterone, but it could also be, depression or something like that, couldn't it? So what testing do you use to sort of really, dial in on the diagnosis?
Yeah, so I think people have to realize that there's several facets here or several complicated moving parts that are so necessary to understand. Number one is you have to have a pattern of clinical symptoms that are present and enduring to at least give you a sense that making this diagnosis or at least pursuing it makes a lot of sense. So you have to look for all of the signs and symptoms that I mentioned before, like, is your patient describing a loss of libido or a lack of sex drive? Are they describing erectile dysfunction? Do they feel more fatigued, or do their muscles feel weak? Are they having mood-based problems or a lack of general motivation? And then if you're sort of saying that exists, and this person, let's say, is 50, 60, 70 years of age, or at least in those decades, then you'd want to run a total testosterone level And it certainly looks like that would be the best initial test to do, but there are some moving parts that make the diagnosis a little more complicated. But essentially what you want to see is a low total testosterone level in addition to at least, I would say, 3 of those symptoms that I mentioned. And if you have that biochemical evidence plus those 3 symptoms, then at least it gives you the idea that this person does have andropause, and then you'd have to kind of go from there. But there's definitely a lot more to distill here, but that would be essentially how one could make it a diagnosis in I would say from a simple perspective.
I hope you enjoyed that highlight from a recent program on Nutramedica. If you want to get access to our full-length shows and live interactive events, you'll need to register as a healthcare professional at Nutramedica.org. To stay up to date with our latest programs, go ahead and subscribe to this YouTube channel, and don't forget to hit that notification bell. We'll see you soon at Nutramedica.org.